then you overlay a tax, and we asked the DCBS folks, we said, okay, so if the insurance companies can't factor in the 1.5% tax in 2018, so the tax goes into effect, but rates have already been set, can they go back and factor 3% for 2019? And the answer was yes. And that's before the federal government, under the current ACA, also inputs a tax next year at the federal level. So when you're talking about a 14% rate increase from Kaiser, and a 1.5% tax, and a 3% tax from the feds, we're talking about people who are going to see upwards of 20% in the increase in their cost of their health insurance. And no amount of a reinsurance program that really is just a Band-Aid because we didn't get enough lives in to cover Oregon or the health exchange for failure on the legislature's part. No amount of a Band-Aid and using general fund to backfill insurance companies is going to solve that problem. I mean, we have a systemic healthcare problem in this state, and because the fact is, whether it's SEIU, who wrote Governor Brown, $180,000 for her reelection last year, or the Medicaid, for-profit Medicaid folks who wrote Governor Brown a $73,000 check. Remember, she said this was her number one priority. Well, she passed it, and the referendum committee members who all got Medicaid checks right after the session ended. I mean, there's big money. The for-profit Medicaid folks since 2008 have put $4.4 million of Medicaid dollars into campaigns. And we've acknowledged, look, they gave us the money too, but we're also saying, you know what? That's not acceptable anymore. We can't do this. We can't use our tax dollars this way. And so, they're not real happy with us, right? They've called us names. They've asked people to spy on their neighbors if they're signing these petitions, go out and find it and take pictures and stuff. Horrible stuff coming out of them. But, this is their cookie jar. And they're not really happy that we're, shining a light on what is otherwise, a very complex sort of money laundering type scheme to pull money out of Medicaid.